I think everyone at this point is aware of the opioid crisis in effect on the United States, and many people have a loved one that's been affected by the opioid crisis or involved or knows someone that was involved. When something's this massive or the problem's this big, it's paralyzing. I think people have a hard time understanding, or maybe they feel like they can't do anything to help the problem.
And what we're talking about here are common pain medications that are prescribed every day. So oxycodone or morphine are two people are probably familiar with. But also maybe less talked about, but equally dangerous, things like synthetic fentanyl, which is now becoming a street drug and is 100 times more powerful than morphine, or heroin, which people are also in general familiar with. Unfortunately, the most common way that people become addicted to medication, addicted to these opioids, is by misusing medicine that's in a medicine cabinet of a loved one or in a drawer in a bathroom somewhere. And then their use or abuse of that medicine, turns into an addiction that often ends badly. I think we have a broader responsibility as healthcare providers when it comes to this opioid crisis.
I think one of the responsibilities is to govern those medicines that we give our patients. We've done this by starting a program called Crush the Crisis. So in essence, we're partnering with local law enforcement to reduce the population of pills, basically, to take back these opioid medicines from patients, removing them from their homes, and in the process, hopefully, not only educating that patient and their family, but perhaps the local community about the danger of these unused medicines in their home.
Absolutely. We're really excited about our participation with the National Academy of Medicine and their collaborative to reduce the opioid epidemic. We're partnering with 50 other organizations who all are working together to identify best practices, seek out the gaps in treatment or in research so we can understand how to better take care of patients who have opioid use disorder or prevent patients from getting there in the first place, and really excited about the impact that collaborative is going to have on our communities. We also have a number of initiatives that we're rolling out across our company, kind of focused on us and our own patients. So the first is something called Enhanced Surgical Recovery, or we refer to it as ESR. And this is a program that focuses on surgical patients, and it really seeks to improve their recovery and limit the amount of opioids that they need to take in order to feel better after their surgery. Another example is something we call ALTO, which is the Alternative to Opioids in the Emergency Room program. This focuses on patients who are coming to our ER with common painful conditions, who in the past may have always just immediately gotten an opioid or a shot, and instead we're going to treat them with an alternative which is evidence-based and we know will be successful at limiting their pain. Through that program, we've seen over 30% reduction in the need for opioids, but really have seen an amazing positive response from the patients as well. It's been a successful program. We look forward to rolling it out across the country this year.
I think as healthcare providers, I think if we've got an opportunity in front of us. I think if we address this crisis patient by patient, prescription by prescription, and in doing that, educate the community about the dangers of opioids in the home, we can do our part to stem the tide of the opioid crisis.
Participating in fighting the opioid crisis really speaks directly to our mission at HCA. We are, above all else, committed to the care and improvement of human life, and there's no way to address that better than keeping patients in our community safe from the risk of opioid.